our Vice President membership and OPF executive member, Dr. Farhan, Dr. Mohammed Farhan. He is associated with the health sector since last 2 decades and playing a very important role in this current pandemic as a frontline doctor. So I will hand over to our president, Dr. Syed Kaisar Anis, who will give a brief idea about this one, and then Dr. Mohammed Farhan will take over from him. To our president, Dr. Syed Kaisar Anis. Thank you.
Assalamu alaikum everyone, and thank you Iqbal Naseem Saab. Thank you for introduction. All the audience and who was listening or attending and participating, this is the 4th session of our own pandemic by Pakistan Business Professional Council. We are continuously updating on each challenges and how to live safely in United Arab Emirates, and how to protect your family, your children, and your life. We are guiding time and again, both on the side of health, finance, and all the areas. This session, where we would like to update on the vaccine update and public health awareness. We have our speaker, Dr. Mohammed Farhan, who is Vice President, Pakistan Business Professional Council. He was leading our health committee also, where if you visit our website, you can have all the updates on the health sector. And Mr. Mohammed Iqbal Naseem, who is on our Vice President program, he conducts for the travel. So it's well informative website of ours. Whenever you do any action, you keep on looking on that, you will have current update on both on travel and on health. And I would like to invite Mohammed Farhan Saab to address to the participant. Over to our Vice President.
Thank you very much, Mr. President, Dr. Kaisar Anis, and VP Program, Mohammed Iqbal Naseem, for inviting me on this important webinar, which is known as COVID Vaccine Public Health Awareness and COVID-19 Vaccine. My program and my presentation based on, I will start from COVID-19, some introduction of the disease, some introduction of the pandemic. Then I will give you the brief information about COVID-19 vaccine and updates. And I will clear some myths and I will explain you the facts of COVID-19 vaccine. My name is Dr. Mohammed Farhan. I am serving in health sector in Abu Dhabi from last 2 decades. And at the end of the presentation, if you have any question and answer, you can ask me and feel free and we will discuss it. COVID-19, from 29th of December, I will give you some brief introduction. COVID-19, first case we just found on 29th of December as a case of pneumonia in Wuhan, China. And after that, these cases are increasing in China, and China just alert WHO and the cases increasing. And then 30th of January 2020, WHO just alarmed all the world that there is a pandemic and there is health emergency, and we gave the name COVID-19. I will explain you slightly about how the COVID-19 came, what are the factors, which from the food, from how it goes, how it is spread, what are the risk factors. COVID-19 basically, what till now we have researches shows that the Wuhan, there is an animal and seafood live market. From there, some cases of Wuhan came. And this is maybe, animals, generated virus. It's a large number of virus, and the molecule of the virus contains genetic material. And this genetic material enclosed with lipid membrane and spike protein, and it appears like a crown. So in Latin, we said the crown in Latin means corona. So that's why they give this name COVID-19. So that means a crown-shaped virus, which is diagnosed in 2019. Researches are going on, and still we have more data and researches, but all the world and researchers and the scientists are working to kill and finish this pandemic. And Alhamdulillah, as compared to 2019, we have enough data, we have enough researches and available, and we are trying our best to finish this pandemic. We need all of the world patience, discipline, follow SOPs, and one day we will overcome this virus. The transmission of this virus is, of course, from animals to human and human to human. How human to human? By the droplet, whatever the secretion from the nasal secretion from droplet. And this droplet, if we go to any, will drop into any hand hygiene, like surfaces, like tables, like wallets, like keychain, and then somebody touch, and then from their hand to touch the nose and throat, so how it transmits. So this is known as droplet infection. So that's why WHO emphasized for just wearing the mask and make social distance and hand washing. I will go into details. Symptoms. Whenever the virus comes in the human body, it takes normally 5 to 7 days to give the symptom, which may vary to 5 to 12 days. So normally that's why we say if you have a symptom, so don't do anything. First thing, you have to isolate yourself so you will not give this virus to others. So whenever you feel symptoms like fever, headache, nose running, sore throat, cough, fatigue, loss of smell, loss of sense of taste, so immediately you have to inform the health authorities. We have hotline available, and after that you can isolate from your family, and then we will go do the second step, which is the diagnosis. How we will diagnose the pandemic COVID-19? There is one test available before. This is known as reverse transcriptase PCR, polymerase chain reaction. Normally in our non-medical term is COVID PCR. This is the nasal swab, and this is easily available everywhere. And this PCR is the initial diagnostic confirmed test to detect the COVID-19. After the disease, like after 8 days to 14 days, you will have the blood test which shows the COVID antibody after the disease ends or in the middle of the disease. That means your body is reacted or your immune system is activated, so you have antibody. So normal first diagnostic test is PCR, and after 8 to 14 days, we recommend the people to do the COVID antibody. That means the body already reacted and fight against this virus. My recommendation and my experience from 2019 till now, this virus give lesser effect in a young people without any disease, and it may be asymptomatic or carrier from 10 years to 50 years without any symptom or any mild symptom. But the problematic thing is after 50 or the known case like age, known case of diabetes, hypertension, heart disease, asthma, and like a cancer disease, and those conditions who have the patient immune responses less, this is the condition, this is the thing where we have to make extra alert for the people, because high-risk patients are more prone to have the moderate or severe symptoms, including pneumonia and multiple organ failure, and might go to end up with death. So high-risk patient or elderly patient, we have to take extra care for that. And this is the point where have to taken care of. How to treat? For this virus, like other virus, the treatment is only symptomatic treatment. We have to treat the symptoms, like we have to control the temperature, we have to take enough fluids, we have to take vitamins like vitamin C, vitamin D, zinc, healthy diet, lots of fluid, steam and all. So body automatically, when we have all this available, so body immune system will activate and kill the virus in a better way if the person is healthy at younger age and less chances to get moderate and severe disease. How to prevent it? This is the most important factor till now, and this prevention is actually the treatment for all of us, because everybody is home. There is young people, there is old people, there is child, infant. So we have to take care of every home, because every home we have parents available, or we have grandparents available, we have father, mother, or we also have diabetes, hypertension. So we have to take care of it. Prevention is the first prevention, which is very important and guided you all, and you have public awareness, is you have to make social distances, which is 6 feet or 2 meters from each other. Hand washing is very important, either with water, soap, or with hand sanitizers. We have to wear mask all the time if we go out. We have to take care of the families, make social distancing. Don't take your hands or touches your hands to your mouth and your nose oftenly. Just you take care before eating or after eating, and while you're touching, you just do hand washing a lot. So these are the basically measures. When you have sneezing, take a tissue paper, immediately clean it, and then just throw this tissue paper in a closed bin. Don't throw any droplet or secretions or tissue paper in open bins. It might spread to other. And then you can wash hands again. So what we learn in public health awareness data is mask is important, very important. Hand washing is important. Social distancing is important. We should not go to a close gathering where in a hall more people are there. We have to restrict our travel. We have to maintain the social distancing. And by these measures or maneuvers, we will stop the spread of the virus. And of course, there is a line, we all are responsible. There is not yet confirmed treatment is available, but yes, we are doing best, and our researchers and data analysts are doing the research, and all world scientists are into it. Then we will end up with pandemic. From 2019 till now, we are slightly better, but still the virus exists. So we have to do our level best. At the end, if you have any question regarding this, so I will give you the answers. And after that, we will give 10 or 15 minutes question answer sessions. This is the intro of the COVID virus. Now, I will go to the topic which is very important from last August 2020, which is known as COVID-19 vaccine. This vaccine is blessing for us, and thank you for all the scientists who made the day and night effort to make this vaccine. I will explain you what is vaccine, introduction of COVID-19 vaccine. I will give, kindly put the slides on that. I will give you the update of the vaccine trials, how the vaccine formed, what is vaccine, and after that I will give you the dosage, and I will explain you who can take the vaccine and who cannot take the vaccine. I will clear all your myths, all your negativity. I will give you all the answers. COVID-19 vaccine really is a blessing for everybody to protect our frontliners, those who are in the field, our commercial people, and our high-risk patient. What vaccine does actually, I will explain you. And after that, if you have any questions, please write it down. And at the end of the presentation, I will give you the answer. Next slide, please. Next slide. Vaccine introduction. Vaccines actually work by preparing the body's natural defense mechanism, which is known as immune system, to recognize and fight against the antigen, which is the outside body. Body detect the virus, bacteria, and they target, and they kill the foreign body and to harm us, and they give the cover to the body. Since the emergence of novel coronavirus in December 2019, scientists around the world are working faster than ever, believe me, to develop and produce the vaccine that can spread the COVID-19. As of February 2021, at least 7 to 8 different vaccines have been rolled out in the countries. More than 200 additional vaccine candidates are in the development process, and more than 60 countries are working to make the vaccine. This all data is approved by WHO and CDC website, and you can get it easily. So this is confirmed, approved health authority, data. Next slide, please. Vaccine phases and trial. I want to explain you why we do the vaccine phases. What do you mean by trial? Actually, before any medicine approved in the market, it have the different stages the vaccine has to go through it. First, when they make any medicine any molecule or anything which they want to give to the human body, first they tried it on small animals like cat, rat, rabbit, monkey. And after the vaccine, we go to the different phases. First animal trial done, then we go to the human trial, which is known as phase 1 trial. Phase 1 trial, they give the vaccine in a very small number of people who are healthy, and they just give a small number of people they can monitor on daily basis and weekly basis for any side effect. If we pass phase 1 trial, then we will go to second trial. After the success of phase 1 trial, then there will be no side effect. Then we go to the larger group of the people, and we continue to monitor first phase trial people, then larger group is second phase. Once first and second phase trial, we will not find any side effect, then we will go to phase 3 trial. And this phase 3 trial, we will involve thousands of people to confirm the effectiveness of the vaccine, to see the immune reaction and antibody in the body. We continue to monitor, and we monitor any side effects. Phase 4 trial, which is the last phase trial, where the vaccine is given in phase 1, small people, is phase 2, larger people, and phase 3, thousands of people. If we succeed all, then phase 4, we will send this for countries, health authorities for approvals, and health authority approvals. Then there is a board, and their deep experiments and deep clinical trial, and after that it will come into the market. This is not for COVID. This is for any vaccine and any molecule and any drug in the market. Change the slide, please. Benefits of getting the vaccine. Some people have myths. I will explain you in the next slide. That, as I mentioned, that COVID-19 vaccine produce the protection against the disease and increase the immune response. So what COVID vaccine does, it will increase the antibody in the body, immunoglobulins, which are your immunity. So when the virus will come, so automatically in your body, there is immunity available. So you will end up COVID-19 with a mild symptom. So there are more chances that you will not end up in moderate to severe symptoms. And of course, this reduces the risk of developing illness of moderate and severe consequences. COVID-19 getting vaccination, go back. Getting vaccination may also protect people, because if you protect it from getting infirmity from disease, you are less likely to inform. So you will not give infection to others also. So it will work in two ways. First, protect yourself, and 60 to 70%, it will just, from your side, you will not give droplet infection to others. So it will protect to others also. This is particularly important to protect people at high risk, as I mentioned you, above 50 patient, with diabetes, hypertension, cancer patient, asthma patient, any neurological disease patient, or any chronic illness which is not controlled, such as healthcare. This is particularly important to protect vaccine from healthcare workers also, elderly also, and with chronic medical conditions also. Change the slide. COVID-19 vaccine in a dosage. We have the SARS-CoV vaccine, which in Abu Dhabi, normally we conducted the trial of Cyanofarm, which is a dead virus vaccine, and they will acquired immunity against the vaccine. Vaccine given in 2 doses in UA, first dose in the first day, and second dose between 21 to 28 days. And this vaccine course consists of 2 vaccines, one day, and after that 3 weeks we give the second dose. Who can take the vaccine and who cannot take the vaccine? We have a prominent structural guideline, and I will explain you one by one, that healthy individual, the age above 18 and above with the stable chronic condition can take the vaccine. Those who are not stable, they have to consult their doctor to stabilize the condition, get the fitness, and then take the vaccine. The vaccine can also be given to 16 to 17 years if they need it, because if they are going to university, sports people, multiple, but with the doctor's medical report. Vaccine, who cannot take this vaccine, 19 or any other vaccine are harmful to giving these kinds of situations, or these patients like pregnant women, no vaccine is allowed, nursing mother, no vaccine, people with a cancer or immunodeficiency diseases and any blood diseases where the vaccine can harm the body should not take the vaccine. Women planning to become the pregnant in the next 3 months should not take the vaccine. Children under 16, because the trials are going on. So at this time, children under 16 are not allowed to take the vaccine. People with severe allergic reaction to any component in the vaccine should avoid the vaccine. And these people, I recommend those who are not allowed to take the vaccine, please kindly continue COVID SOPs and follow up the guidelines, how to stop the spread, as I told you, with wearing the mask, stay at home, social distancing, hand washing, and don't go to the closed spaces with multiple, gathering. Change, please. COVID-19 vaccine side effects. I can say the side effects are normally with every vaccine. What I mentioned is not only belonging to COVID-19. You take any vaccine, either yellow fever, either malaria vaccine, either hepatitis vaccine, pneumococcal vaccine. These symptoms are normal with everything. So don't be scared that COVID-19 gives some extra side effect. But yes, as we discussed, the vaccine may give you side effects are as follows, which is pain and tenderness on the side of the vaccine, itching on the body, body pain, fever, headache, fatigue, some cases 2 to 5% nausea, vomiting, diarrhea, muscle pain, feeling of weakness, feeling of illness, which is lethargy, and joint pain, arthalgia. My personal experience, I have seen less than 1% side effect in the community, 99% of a community feeling very well without side effects. But yes, if the symptom after the vaccine persists after 2 days, so you have to consult your doctor, and then we will do the investigation and we will find out the solution. Whenever you take the vaccine, I recommend to take Panadol or paracetamol for 2 days, so you will not feel anything or side effects. Safety measures after getting the vaccine. I told you, and I am assuring you here also, that if you take the vaccine, don't think that you have to stop the COVID measures and SOPs. No, it is not like that, because no vaccine will give you the 100% protection. So with the vaccine, you try to make your immunity develop, plus vaccine is not giving you 100% protection. So continue the SOPs like we are doing from 2019, wearing the mask, social distancing, and hand washing, and avoid travels. And these are the things which I explained you earlier. Second thing, wash hand with soap and water and multiple times if you go out. Clean and disinfect the touch surface. Suppose if you go to your office, first clean or sanitize your table, your chair by yourself, which I'm doing every day, with your glasses, keys, wallet, your personal utensil. Every day you have to, because suppose some other droplet infection, if go to the key or wallet and you touch your face and nose, so it will spread and then go to your family and your elderly, high risk, or children. Make the distance of course 6 feet or 2 meters from the other person. Avoid going to the crowds, I told you, or in the closed areas. Still, you have to restrict your domestic and international travels. Still follow guideline in the workplace, which every institution already approved by the Ministry of Health or Health Authority or Department of Health. Watch for the symptom. Believe me, if you have minor symptom without anything, first step is to isolate yourself, inform the health authority, inform your office or your manager that I am isolated, and then the hotline for health COVID pandemic is there. They will guide you and they will do the PCR immediately, and they will isolate and do the further protocol what we already have the guidelines. Now, I will give you some myths and facts, and this is actually my patient questions and my answers to them. So I thought I will give you some feedback that what's in the public or the community in the mind before taking the vaccine. and we will discuss, so it will be beneficial for you. Mostly my patient, when it comes to take the vaccine, they ask me that, can a COVID-19 vaccine make me sick and give me COVID-19? So as I told you in my presentation, that this vaccine is dead virus. So it will only make your immunity booster, but it will not activate your COVID-19. So my answer is no, that COVID-19 vaccine will not give you COVID-19 disease. Number 2 question, after getting a COVID-19, will I test positive on the viral test? My again answer is no, because this is the dead virus. You may have only some symptoms because this is the dead virus, but the positive, only antibody can be positive due to immune, but PCR, normally it is not detected after this vaccine. It's question number 3. If I have already had COVID-19 and recovered and I have antibody already available, do I still need to get vaccinated with a COVID-19 vaccine? The guidelines for, yes, if you have COVID infection, so after 3 months, if you are high risk or if you are front line workers or anybody, after 3 months, it's safe to take vaccine and it will be beneficial for you. Will a COVID-19 vaccine alter my DNA? No, it will not alter your DNA. Some people always try to get some negative thoughts that there is some microchip, it go into the brain, into blood, it will monitor you. No, there is no evidence for this, that this vaccine has no microchip. The COVID-19 vaccine will make you infertile and will make you weak. No, there is no evidence till now vaccine impact fertility. Researches are going on, but at the moment till now, there is no case reported for this vaccine. Now, I have to stop here because my very good friend, Dr. Faisal, he was actually on clinic duty, but I requested him to come here and give some thoughts about COVID-19 and COVID-19 vaccine, and he will brief you, and then I will join you again. Thank you, Dr. Faisal Arshad. Are you listening me?
Yes, doctor.
Dr. Faisal, thank you very much for giving me time. I know you are on duty, and as always, we are in the PBC platform trying to help the community about COVID. And actually, Dr. Faisal have been with the field hospital of COVID, and he has a much vast experience about public health awareness. So Dr. Faisal, I want you to just give us your brief experience about COVID-19 and COVID-19 vaccination, please. Over to you.
Thank you, Dr. Farhan, for introduction. Ladies and gentlemen, as you know, COVID as it started, and Dr. Farhan has given a very good and a brief introduction about how the disease is and what type of vaccines are available and how we are getting it vaccinated all over Abu Dhabi and UAE. As you know, what I can tell you more in this presentation is that what type of vaccines are available in the market. The vaccine which is being tested here in UAE, Abu Dhabi especially, was Cyanofarm vaccine. The type of this vaccine is an adenovirus type vaccine. It means that a dead particle of the virus is inoculated or incorporated in adenovirus, and then it's a dead virus given to patients or people to get an immune response against COVID. The other type of vaccine which is available in UAE also is commonly the Pfizer Biotic vaccine, which is a slightly different category of vaccine, that it is a more of a messenger RNA type vaccine, which boosts the immunity against corona by making the same immune response, but without the virus itself at all. And about the efficacy of the two vaccines, there is a slight difference, that this vaccine, what most of the people in UAE are getting, the Sinopharm vaccine, is giving the protection to around 85% of the population, which means that out of every 100, 85 people will develop immune response, which means they will have an antibodies to fight the virus in their blood. The Pfizer vaccine, on the other hand, has a 95% effective rate, which means that out of 195 people will have an antibody response and will fight the vaccine, the coronavirus, against when they took this vaccine. The other important thing to know about the vaccination process is this vaccine are given in 2 shots, 21 days apart, and you receive the second shot after 21 to 28 days. And the difference why it is like this is because the first dose, your body cells get to take this as foreign inoculated injection, and then they try to make the antibodies. But due to certain characteristic of the body, it goes to like a memory part, and then it is not making a complete boost of the immune response. That's why after 3 weeks, a second injection has been given to boost your immunity, so you will get a lasting immunity that can fight if you get in contact with the coronavirus. Now there is a certain debate also that maybe they're saying there's certain group of vaccine, the newer generations are coming, that they are very good for only single injection as well, which is now recently launched, the Johnson vaccine. So these are all happening as this is a new disease to this world, and thanks to the UAE government that they have actively taken part in this project and have acquired and approved the vaccine for the general public use. And the target plan is to have around 70–80% of the population vaccinated, so the herd of the people are immune and the virus will not be that much effective in causing deadly. And this vaccination is completely safe, as we are doing mass vaccination here as well, 1,000 to 2,000, 5,000 people in a day. And the major side effects are not any. Only the minor side effects, as Dr. Farhan mentioned, which you will take any vaccine can happen with this vaccine as well. Who has acquired COVID before and has required an oxygenation and hospitalization, it is advised for them to take this vaccine after completing 3 to 4 months, as Dr. Farhan has discussed already. Other than this particular vaccine is new, and the other option to control this infection is to have an active medicine that can kill this virus. The research on this aspect is already going on, and there are certain drugs are coming, experimental drugs are coming. So once we have a complete good set of vaccines and the drug, this disease might get controlled. But my analysis is that this disease might persist with us for a few more years, and it could be like a common other viruses that we already have, like common cold viruses, other viruses. But the impact on the population may not be that much serious as it is now. So with the time, we will be able to control this through vaccination and through medicine. So for the time being, it's very important for all of us to understand the importance of vaccination, especially regarding the coronavirus, and to actively take part in this viral, campaign that is going on, and to step aside all the negativity that this may cause certain trouble and problem with us. So based on this analysis, I think as Dr. Farhan has concluded that this vaccine is safe. Now the target is to give this vaccine for above 50 of age. Sooner or later, it will drop down as well to 40 to 50, as we will be able to vaccinate all the population above 50 of age. The numbers of corona cases, as you were seeing, also are dropping in UAE nowadays, and it is getting control as well. So hopefully within time, we will be able to contain this disease, and through vaccination is the only hope. So we will not be able to have serious complication for our elderly people. Most of the young generation, they might ask this question that, okay, I am young. If I had corona, my chance of having serious disease are low. So let me have coronavirus and not to take the vaccine. They are, that is a thought, but the problem is you might not get very sick, but you are a carrier for taking this disease to somebody who is immunocompromised and who is elderly and can have serious problems. So to part of the community and humanity, you must take part in the vaccination program as well. Second is, do I have to wear a mask in public when I am vaccinated or not? Yes, you have to be, because you can still be a carrier of the virus and you're not showing any symptom, because you already have good immune response in your body and your body is fighting against the virus very well. But this virus, you can give it to someone in the community that has not taken the vaccine or has a bad immunity. So in that part also, wearing a mask in public, you must be doing it. But once we will reach or achieve a good number, or maybe 80% of the people who are vaccinated, and the case threshold has come down, maybe based on the Public Health Department and Department of Health Abu Dhabi, they might give us a guideline then in which places we can avoid masks and we can act as normally. So based on this analysis, I think this is the vaccine is very important, and we must all take our part in helping and building up the community which is safe for everyone. Thank you. If there any question regarding the vaccine method that you want to ask from the public, if there's any opinion they want to ask?
Yes, so you will stay here. After 10 minutes, I will open the question answer desk, and then if you are there, I will take you, right? So if you have patience, you can go and come back, but we will start question answer after 10 minutes, Faisal.
Okay, thank you very much.
So thank you very much. Thank you very much. I'm really honored to have you here.
Thank you very much.
Thank you. Thank you. Thank you, Dr. Faisal, for the brief, detailed, some information about the vaccine and the points. Now, I will conclude my presentation. I have 2 slides left, and then we will start the question answer. And we are getting your question and answers, and we are noting down. And after that, I will give one by one, and me and Dr. Faisal will give you the info about the question answers. I was there. The vaccine will make you infertile or not? No. There is no evidence that the vaccine impacts on your fertility, but yes, researches are going on. If like these cases, we will update you, but at this moment, my answer is no. Can you change the slide? Question: after receiving the vaccine, you cannot transmit the virus. As scientists are still exploring, a person has been vaccinated should continue to follow the wear mask and SOPs and follow the safety measures, which is very important. And I discussed earlier, and Dr. Faisal told you. So don't do that while if you are vaccinated and you go to the close gatherings and this and all. No, continue the COVID SOPs. This will help you. People with pre-existing conditions should not take the vaccine. No. People with conditions like controlled heart diseases, diabetes, lung diseases can take the vaccine, but with the fitness of their consulting doctors. Chronic disease or high-risk patient, if they are not in the criteria of not taking the vaccine, you can take the vaccine like heart disease, diabetes, asthma, blood pressure, cholesterol, and obese. Elderly cannot take the vaccine. No, it is a myth and it is wrong information. Currently, in the most countries, elderly are prioritized actually to get the vaccine first, because these elderly people will have more chances to end up with moderate to severe COVID disease like pneumonia, lung disease, and multi-organ failure. COVID-19 vaccine, change the slide. Yes, these all informations, I have some question answer I will give you. These all information has been taken from World Health Organization, CDC, Department of Health website, DOH website. So this is approved guidelines. And now I will tell you some information about the virus till today from 29th of December till now, which is 13th of March. We have COVID 118 million, some lakhs, approximately 118 million, 2,68,000 cases reported. We have 2.6 million approximately, unfortunately, deaths in the whole world. And Alhamdulillah, more than 300 million people we already vaccinated in the whole world. So we are trying to get the herd immunity from the vaccine. So I'm always try to emphasize on you guys to get the vaccine according to the guideline, consult your doctor, and just follow the COVID SOPs. I am really thankful to PBC, the platform which from COVID pandemic work very enormously to make this healthcare seminars and public awareness program. And this is our social duty to give the good and important and health information to the others. So if you save one life, you can save one humanity. As our Muslim, this is our belief. And I really love our UAE leadership and government who took part as a first line, and immediately in the whole world, we are most important countries who fought with this virus in a better way. We followed the guideline, and the UAE leadership is still working together to save us as a community. Either you are Emirati, non-Emirati, from where, if you are in UAE, you are the part of the UAE, and together we all are responsible. Thank you very much. And from now, I can open the question answer session. And if you have any question, you can write, you can raise hand, and I will give answer one by one. And then can you include Dr. Faisal also with me, right? Dr. Faisal,
Yeah,
are you there?
Dr. Farhan.
Yeah.
Dr. Farhan, I have a question in respect of antibody test.
Yeah.
Is it important to take after second vaccine, or when should be taken?
Normally, the guidelines are if you take the second vaccine, you have to wait 4 to 6 weeks after the second dose to take the antibody test. And the guidelines are if the antibody borderline, if the antibody is less than 12 to 14, you have to take the vaccine. If more than 25, approximately, you should not take the vaccine again. But when the antibody is become less, that your antibody or immunoglobulin titer less than 12, you can take the third dose, but with the doctor approval and doctor fitness. But normally I advise wait for 4 to 6 weeks after the second dose.
Okay, thank you so much. It was a very important question, because antibody is important to see that how, so the level of antibody should be less than 12 as per your answer.
That's what I'm saying. Yeah, yes, sir. So, I told my patient to wait for 4 to 6 weeks and then do the antibody test.
Yeah. Now the question arises this, that the third dose. So the third dose you can only take if your antibody is less than 12.
Yeah.
Okay.
Yes, but with the doctor's fitness. Yes.
Yeah, with doctor. And now the question comes at how long this vaccine is there. So you have to keep on checking the antibody.
No need. Actually, that's why we are here to get the researches all going on. And then if with the passage of time, actually the third trial ended in November only, sir. So we are on the approval stage. So don't check multiple times. Once you get the vaccine, then just my advice to follow the COVID SOPs. Don't check every month, everyone, because you just follow the SOPs. And as the guideline come in March, May, or June, the completely guideline will come. What is the time frame or the limit of the vaccine? So as Dr. Faisal said, some people said, or some pharmaceutical company said, the one vaccine will give you 1 year for this antibody. So the cover, we will let you know with the time. But one time, if you have antibody comes, then you just live your life happily. But with COVID, just follow the SOPs.
So
Second,
yeah. So that's what we get out of you, that we don't have to check frequently about antibody. One time
I mean,
you can
believe me, if somebody have a phobia, because one of my patient comes every 2 weeks because the antibody test, I have 9, now I have 21. Where is the, antibody is going? You know what I mean? So it will be mental fogging or mental depression, according to me. But the because what happens is, if in your family somebody you can see everyday news like he went to ICU, he died, something like that. So we are thinking it will come to us also, right? So my thing is follow the SOPs, get vaccinated, antibody one time, and then every 2 to 3 months you can repeat, because not every week or every 2 weeks.
You means after 3 weeks you can check the antibody?
After 3 months.
3 months. So you can keep on checking the level. If the level is less than 12, you go for the third dose.
Yes, but this level is only one time. Don't do that. One time come, you take third vaccine, then after 3 months you have 12 less, fourth. No, it is not like that.
No, it's not. So again, one time you can. Very good answer, and very good answer that it is not expiring. Because there's no.
So Dr. Kesar, with the time, once the vaccine approved, we will know with you the timeline of the protection is a cover, and we will get next year with full data when vaccine will come. So no need for antibody, inshallah, for next year.
Great. Thank you very much.
Faisal, the question is for you. Can Cyanofarm protect against the new strains of virus like UK virus or African virus? So what is your opinion about new strains and Cyanofarm vaccine? Faisal, you are listening me? Dr. Faisal?
Yes. I think, yes, I can listen. I can hear you. I think this is still very in an initial phase. But the researchers, what they are saying is that these are, broadly speaking, the spike protein enhancing vaccines. So what their mechanism of action is, they don't allow the virus to bind.
Okay.
Hello.
Yeah.
So any type of vaccine you will take, it have the same effect. The only strain difference about the UK and other is they are more effective in spreading. So the immunity that you develop from any type of vaccine will protect you from all type of strain at the moment. So there is no need to change the strain of the vaccine at the moment. But later on, maybe when there is all type of different strains available to the microbiologists, they may incorporate this to the newer vaccine as well. But for the time being, the researchers are pretty much confident that one type of vaccine will work for all type of strain.
Thank you very much, Faisal. Thank you very much, Dr. Faisal. The next question, when the people do the PCR and it will not update in Al Husn app, what they have to do. So I will give you the answer for that. When you do the PCR test from the Seha centers, they are directly linked with Al Husn app. So 100% it will come and appeared in Al Husn app. But if you do your PCR in some private labs, so what you have to do, and the PCR will not update in Al Husn app. We have the Al Husn app tool-free number. You can go to the Al Husn app website. You can call them from where you did the blood test, and you have to call from where you did the lab test. So the private lab will update in the Al Husn app, and same time you have to inform Al Husn app tool-free number that I did the test from this lab private at this time. So they will contact, and within 24 to 48 hours, it will update in Al Husn app. Second question is, what is the benefit of E or Al Husn app after the vaccination? Remember one thing, if you want to enter Dubai, Abu Dhabi, Gantoud border or Mohammed bin Zayed Road border, you have to maintain E with circle while doing every week PCR. If you do after vaccination of 2 doses, wait for 28 days to become Al Husn vaccination line. If vaccination remarks came in Al Husn app, then every week you have to maintain PCR result in Al Husn app to enter Abu Dhabi, Dubai by road. But if you will miss 7-day PCR, this E will go, and then you cannot come inside. So please, if you are frequent traveler, you have office, so every week you do the PCR and maintain E with circle in your Al Husn app. But if you will come Abu Dhabi without E, then when enter Abu Dhabi, if within 3 days you go back, you have to enter with DPI test. But next time, no DPI, 2 consecutive DPI. One time you enter with DPI, and second time you have to do PCR. And then if you enter Abu Dhabi and you go back within 72 hours, so you don't need test. Otherwise, 4th day you stay in Abu Dhabi, you have to do the PCR, and 8th day you have to repeat the PCR. Now, I have the second question. Suppose the person comes with vaccination abroad to the Abu Dhabi airport, so he has to do quarantine or not? My answer is, if your name in the green countries, I will provide you the website and you can check the CDC website of the green countries. You don't need to do the quarantine. But if you come from the red COVID countries, you have either you are vaccinated or not, you have E or not, you have to get a smartwatch, you have to do the PCR, and you have to finish 10 days quarantine in hotel or at your home.
I have a question. Dr. Farhan. I have a question. Anybody coming here in Abu Dhabi, Dubai, can they go to London or can go to USA? Is there any restriction?
They can come, but within 48 hours, the PCR should be valid. Without PCR, suppose some person come here and the PCR, they stay 2 days. So they have to repeat the PCR and do it. The traveler, a guideline from Pakistan, from India, Sri Lanka, wherever you go from Ittihad to London, and if the airport is open, PCR 48 hours should be valid and approved.
No, the question is important. The question is, can you fly from Dubai to London? After PCR test, of course, you're taking PCR test. Can you fly to London or to New York? This is the question.
See, New York, you can fly, but London, it was closed. But you can see Emirates travel guideline, because London was closed, but now they opened. Okay, few flights. So for the flight travelers, you have to see the travel guide, and this answer will give with Iqbal Naseem Saab, which is Asrin. But according to me, at this time, London flights are going. Please give your comments.
Sir, the Emirates is not flying to London right now. Yes, flying to London only coming from London to Dubai. One flight per day we have, which depart in the afternoon from London. But you cannot carry passengers from Dubai to London.
So his question, so you got the answer that you can come back to Dubai, but from Dubai or UAE, you cannot go to London.
Can we go to Dublin or France, and from there I can go to London?
See, Dublin or all UK is closed. Even Dublin, we cannot fly out. Only incoming is there. But yes, you can check that the flights are going from Oman to London going, Muscat to London going, from Doha to London. Their flights are going, but not from UAE, sir.
One more question. Will the vaccine be available for children? At the moment, no. Vaccine we can give 18 above and 16 to 17 years with seeing the doctor. But less than 16 years, vaccine is not available for children. So it's our duty to follow, let the children follow the COVID SOPs, hand washing, mask, and face mask, and don't go to the gathering. Faisal, Dr. Faisal, one question for you. Please update on Abu Dhabi vaccine ages. I mean, at the moment, which age we can give vaccine, and when they will open less than 50 years vaccine drive. Can you comment, Dr. Faisal?
Yeah, at the moment, because it's the public health department who's deciding, but at the moment, the priority is those who have chronic diseases and those who are above the age of 80, they can freely take the vaccine at the moment. But when they're going to open it for other people, Still, I think the public health department and the government agencies will be guiding us on that. Other than this, if you have any disease like diabetes, hypertension and control, or you're taking any medicine which are suppressing your immunity, you're on long-term use of corticosteroids, you're suffering from asthma, or these all conditions, you can be having a request from your treating physician, and then you can take it to the centers and they might give you the vaccine as you are under category of high risk group. Thank you.
We can hear you. We can't hear you. We can't hear you.
Yes, Dr. Kaisar, are you hearing me?
Now I can hear you.
Yes, thank you, Dr. Faisal. And I'm closing my presentation because we finished all the question answered. But at the end, if you have any further question answer, you visit our Pakistan Business Professional website and we have the help desk here. I will update every week the help updates and I will give every week the answers there. You can ask anytime. And thank you, Dr. Kaisar, for providing me this platform. And I'm always available. And the mic over to Mr. President to closing this webinar.
Thank you, Dr. Fransab. Actually, the platform is yours. Responsibility yours to update to the members and to the community. Yes. And I thank you for providing the update on vaccine. I thank you for public awareness, which you are continuously doing that. It's a great service. I thank Dr. Faisal, which has done a very good analysis on Cyanofarm and all Pfizer, Biotic, and Johnson vaccine. Nicely, he explained it and the difference between Cyanofarm and Pfizer Biotic, because there are a lot of discussion in the market whether we should take Cyanofarm, whether you take Pfizer Biotic, and nobody, we are all ignorant which one to go, where to go. And of course, now Johnson is coming with a single vaccine, so the community is confused completely, and they cannot list it down which is good and what is not good. It's a really a different situation, and you are the first frontliner can guide the community in the coming session to satisfy more to them. The objective of this vaccine is to protect you, which you rightly said. And the protection is, of course, you have to build the immunity together with that. Vaccine you can take, but you have to build your immunity, which is most important thing. And there are steps there to look into it and how you will develop your immunity. And the awareness which you give, which you always give on that account, that you keep the SOP, the distances, the mask, the cleanliness, and your common sense, which I always say, take your common sense, how you feel, the symptom, as rightly said, from 5 to 10 days or 5 to 12 days, it matures. So before 5 days, see, with this work going on since July, I'm coming to the office, but we have some basic SOP, and I will share with you all, and I will suggest you should do that you should gargle now and then. There's no harm. It doesn't take much time. You gargle, clean your throat, and you try to do weekly steam, have a steamer. You will enjoy your everything if you have the steamer. It's a great protection. It is good for your health. Otherwise also, it cleans your throat. This is my ignorance. I'm not a health specialist, but these are the steps, and building immunity is the steps to be taken. I really thank the President, His Highness Sheikh Khalifa bin Zayed, the Prime Minister, Sheikh Mohammed bin Rashid, and our Crown Prince, favorite Crown Prince, Sheikh Mohammed bin Zayed, and the rulers who has provided us such a great facility. Honest to God, we are very lucky to be here, and the way, as Dr. Mohammed Farhan said, that the facility we have provided is excellent, and we were lucky to have this vaccine. I know in other countries, they are fighting to get the vaccine. Although now here also getting some struggle, getting vaccine for younger people, but I'm sure they will cope up soon. And you rightly explained about the travel, especially Al-Husn app is a great app. You can use that And the facility on PCR, I will share with you so that everyone should follow. Maybe they are following, but when I go to Dubai, I step on the Delma street. They have a very huge PCR test area. It takes 10 minutes to get the PCR. 10 minutes, less than 10 minutes. Take the PCR, go to Dubai, stay as long as you can, because that is life for 7 days. And even if you want to go to the ministry here, in any ministry, everyone wants to see that whether you have been tested or not. You can show the Al-Husn. I have been visiting many ministries, showing to them, okay, here it is, and I'm entered that way. So this is my advice to everyone for this thing. This was the 4th session. Pakistan Business Professional Council, the board and the members are very thankful to serve the community here and beyond the borders. And we are here for anything, anything you needed. You can put questions to our website. We have a website. The health desk is there, travel desk here. Mr. Mohammed Iqbal Naseem is going to be conducting sure, and even for the travelers also for their guidance. Thank you very much, and thank you for participating.
Thank you.
Iqbal Naseem.
Thank you very much, President Pfizer. I would like to thank Dr. Farhan, very comprehensive, detailed guidelines he has given, and he has given all the normal questions which people ask. So he shared all the questions and layman questions, the normal people in their mind about the myth of the regarding to the vaccine, and he has answered very nicely. And Dr. Farhan as well, Dr. Pfizer as well. Both doctors, thank you very much on behalf of Pakistan Business and Professional Council, Abu Dhabi. And we will conduct the next session, the same thing, after 3 months. Thank you very much. Thank you.
And the last thank to our heroes, the frontliner.
Yes.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.